3:28 a.m. The next morning.
Mr. H came to the doctor for follow-up treatment after a second-degree burn on the palm of his hand. In this case, patient have redness, swelling and blister on the palm of his hand. So, in details, a second-degree burn is a mild to moderate burn and is the most common type. A burn is tissue damage caused by a heat, chemical or light source. A second-degree burn damage the outer layer of your skin and the second layer of your skin. The most obvious feature of a second-degree burn is skin discoloration, blister and swelling. In the hospital, the Vancouver Scar Scale (VSS) is used to check the scar. The VSS looks at 4 things: vascularity, pigmentation, pliability, and height. Each is given a score. The patient also has weak grip strength and limited movement in the wrist, especially when bending it. For this session, we use a goniometer to measure how far the fingers can bend and straighten. We also check if the patient can make a fist and hold object properly.
The following day.
For the next part, Mr. H came to see an OT to undergo therapy aimed at preventing hypertrophic scars, improving joint range of motion, and enhancing grip strength in the affected hand. There are several massage techniques. First, use a slow circular motion. Second, apply a firm back and forth motion on the scar area. Lastly, pinch the scar between 2 fingers. For joint range of motion, the therapist suggested that Mr. H use several tools to improve the function of his hand. Among these tools are the DigiFlex and a stress ball. The DigiFlex is used to improve finger strength, flexibility, and forearm strength. Meanwhile, the stress ball is used for enhancing gripping ability. Here are 2 examples of muscle exercise for the wrist. The first one is muscle extension. The second one is wrist ulnar and radial deviation.
2 weeks later.
So in this scene, you can see Mr. H is having a consultation with the doctor regarding the burn injury. After a thorough examination, the doctor considered that the patient complied to the treatment by looking at the scar. The redness has faded over time and it will fade completely as time goes by. Meanwhile, for the joint range of motion, Mr. H is able to flex the finger much better than before. However, the patient still has to practice fingers exercises in order for the hand grip strength to be restored completely. In conclusion, the doctor decided that Mr. H is ready to be discharged but must comply to therapy for therapy.
4 to 6 weeks later.
Jadi setelah saya menjalani rawatan untuk tangan saya yang melecur, tangan saya sudah sembuh. Sekarang saya boleh bermain badminton tanpa rasa sakit pada tangan saya. Dan saya boleh kembali menikmati kehidupan harian saya.